the uterus. The uterus has three parts. The lining of the uterus is the endometrium. Endometrium has two parts. The outer part is the functional layer. The pink part here is the functional layer. The functional layer is the layer that sloughs off every 28 days as menses. The inner part is called the basilar layer. These lines you see here, that's the basilar layer. The basilar layer rejuvenates, or it restores the functional layer. The basilar layer is permanent, whereas the functional layer is not. 90% of the uterus is myometrium. This is the smooth muscle here. Okay? And on top of that, you have the perimetrium. The white line would be the perimetrium. Okay? All right. Now, the opening of the uterus here is the cervical os, OS. Cervical os. And this is the cervix. Okay, this is the cervix. Okay? Right here, the opening of the cervix is the cervical os. Leading to the cervix is the vagina. The vagina is a muscular tube, and it has these folds. These folds are called rugae, R-U-G-A. The rugae increases the surface area of the vagina. When the newborn passes through the vagina, of course, the rugae will disappear because the vagina expands to allow the movement of the newborn, or the delivery of the newborn. Okay. Let's look at the external genitalia. This is the labia minora. This is the labia majora. Labia means lip, L-I-P. Okay. This is the clitoris. The clitoris is an analog of the penis. Everything the penis has, the clitoris has. It has the glans, which is the head of the clitoris. It has a shaft. It has a prepuce. The prepuce is formed by the labia minora. It also has erectile tissue and an emission that comes with orgasms. Also part of the external genitalia, you have the mons pubis, M-O-N-S, pubis, P-U-B-I-S. Mons pubis is the fat pad over the pubic symphysis. Okay. All right. Let's look at the pouches. There's a pouch between the rectum and the uterus. That's called the recto-uterine pouch, right here, recto-uterine pouch. There's a pouch between the urinary bladder and the uterus, and that's called the vesico-uterine pouch. Vesico, B-E-S-I-C-O, uterine pouch here. Okay. This is the recto-uterine pouch. And this is the vesicles between the uterus and the urinary bladder. This is the urinary bladder, and this is the urethra. Urethra. Okay. All right, let's look at these. This is the broad ligament here. This is mesentery, and this broad ligament stabilizes the position of the uterus, fallopian tube, and the ovaries, and the pelvic, right here. This is the broad ligament. All right, let's look at this. This is the suspensory ligament here. This is the suspensory ligament. What number is that? 11?
Wait, can you?
What number is that?
60, I believe.
No. What number is this? 20 what?
29.
All right. 29.
Wait.
11, you need glasses. Okay?
Can
All right, 29.
you point it out?
Right here. There. See this? This is the suspensory ligament. The suspensory ligament is attached from uterus to the pelvic wall. Okay. Next to that, we have the fallopian tube. There are 4 parts of the fallopian tube. The red here is the fimbria. All right, the fimbria are the finger-like projections of the fallopian tube that will attach to the ovum when it's released from the ovary. The yellow here is the ovary. That's the ovary here. Okay, that's the ovary.
Is it on that too? Or no?
Yeah, it's on ovaries on there. Okay. Next to the fimbria, you have the infundibulum. Infundibulum is right next to it. Okay, infundibulum. All right. Infundibulum. Infundibulum. Midway of the fallopian tube is the ampulla. Okay, this is the ampulla in the middle. Ampulla, A-M-P-U-L-L-A. Ampulla. Okay. The last part of the fallopian tube is the isthmus. The isthmus, I-S-T-H-M-U-S. I-S-T-H-M-U-S here. I-S-T-H-M-U-S. I-S-T-H-M-U-S. Okay. All right, so those are the 4 parts of the fallopian tube. Now, attached to the ovary is the ovarian ligament. So this is the ovarian ligament here. Okay. This is the ovarian ligament here. Okay. Attached to the ovary. See that? That's the ovarian ligament. See that? Okay. Those will definitely be on my exam, so know those. Any questions about those? All right. This is the sigmoid colon. This is the rectum. The rectum has 2 anal sphincters. The internal anal sphincter is here. External anal sphincter is here. And this is the anus. Who wants to be first?